Hey everyone, welcome back. I hope you had a good break from the abuse prevention video. If not, and you're like me and you just want to knock them all out at one time, well, I've got something in store for you right now. We are now going to be talking about effective communication. Kind of like this, right? It's kind of tough though, because I'm communicating with a camera. Be a lot easier if I was communicating with you directly. But again, this is something that we're doing here at GoL to try and make it easier for you to do the first part of orientation at home and on the comfort of your couch versus one of our chairs inside the conference room. So without further ado, I'm going to go ahead and get us started on our PowerPoint, which I'm hoping everyone can see at this time. And from what I see on my end, you absolutely can. So this is our PowerPoint on effective communication. I know it shows that it's your third box on your checkoff list, but we did cover dementia management in the previous abuse presentation. So I'm going to go ahead and cut the video now so we can improve our bandwidth, and I am going to get started on this presentation. So, what are our objectives for today? Well, our participants, you guys, should be able to describe effective communication and teamwork. We should be able to describe why teamwork, training, and improved communication optimizes resident safety. We need to list barriers, tools, and strategies to effective teamwork and communication. There's something missing there. To show effective teamwork. Let's put show in there. Describe selected teamwork and communication tools, and then review solutions to communication challenges. So let's talk about our overview. What is it? Why is it important? And why is it important? What are our barriers to the end strategies? I'm sorry. What are the barriers and what are the strategies for improvement? So, effective communication describes a process of dialogue between individuals. The skills include speaking to others in a way that they can understand, and active listening and observation of verbal and nonverbal cues. Understanding what the resident is trying to communicate is essential to giving a response. Additionally, effective communication ensures that information provided to the resident is provided in a form and manner that the resident can access and understand, including in a language that the resident can understand. You heard me bring up in the last video that I used to be a respiratory therapist, which I still technically am, okay? There are certain words that we have in our, technical dictionary that the patient isn't going to understand. What we need to do is utilize a jargon or a form of speech that they would understand. So I could say, well, there's left lower lobe atelectasis with pneumonia. Patient goes, so what does that mean? Well, you have a spot inside your lung that doesn't have any air moving in and out of it. It's a lot easier than saying the latter. So always know your audience, so to speak. And you may have a technical person who understands those concepts, and you can provide them with that detail. I mean, I know that we've all gotten our education and we're eager to use those terms, but at the end of the day, our goal should be to effectively communicate what's wrong with the patient to the patient so they can provide informed consent. That's really what this boils down to. What is the other bullet point here? It can also pertain to information needed to keep residents safe. That should be received, understood as intended, and shared at the appropriate time between staff members. Effective communication has been shown to decrease medical errors, improve outcomes, improve satisfaction, and improve resident safety. Barriers to communication and strategies for improvement. So we have a list of barriers on the left. We have strategies to improve communication on the right. Let's pick a couple of these, right? Because we're all aware of a lack of time, lack of information, lack of coordination, distractions, fatigue, workload, misinterpretation, and lack of role or clarity. So workload should not be one in this facility, as we have done it very nicely for y'all. The strategies to improve the communication would be to conduct staff huddles. It's very important for us here at GoL Health that you guys utilize something similar to an SBAR type form communication. We have created a form for you here on the nursing side of things for CNA to CNA report. for CNA to the LVN report, and then just interdepartmental communication forms. I'm not saying you have to use these, but we've employed them in such a way to make your life easier. So we have them printed out. They're inside the two black storage devices that we have to hold the patient charts. I'm looking at one to the left of me right now as we're assembling the patient charts, and utilize that to make things smoother, right? My expectation is that you do a walking shift report where you talk with the oncoming shift about how the resident was. Is there pertinent information during your shift that needs to be translated on to the next staff member? So that will help with that. We see here team steps, handoff, callouts, checkbacks, the 2 challenge rule. Let's continue on. So we have planning, a brief short session prior to the start of assigned roles to establish expectations, outcomes, and contingencies. Yes. Problem solving, huddle, a meeting to discuss the situation, plans already in place, and assess the need to adjust the plan. Process improvement. So a debrief. So let's say that there is some type of an issue that happens with the patient. I'm going to give you a hypothetical. Let's say that one of the patients is walking down the hallway and they trip over another resident's walker and they fall and they sustain an injury. We should find out through a root cause analysis, an RCA, what the problem is. Okay. Well, let's say hypothetically it's not here at this facility, but let's say there's not enough storage inside the patient's room for extra medical devices that they may have. In facilities, they may need to have a designated room to place those items to make them available for when the patient is in need of those devices. In our facility, we have plenty of room, so there really shouldn't be any excuse for that. I'm just giving you a hypothetical situation. So a root cause analysis is done, and then a process improvement plan gets issued. The staff will no longer allow these devices to be stored in the hallway as they cause a tripping hazard. Or maybe it's one of the medication cart or something along those lines, guys. I'm just trying to give you some round examples. Those of you who are unfamiliar with what an SBAR is, an SBAR is situation, background, assessment, and then recommendation and request. So situation, what's going on with this resident? What's the clinical background or context when we're looking at background? And then assessment, what do you think the problem is? Or what do I think the problem is? And then recommendation and request, what would you do or what would I do to correct it? Patient's sodium's way out of range. Patient's blood sugar was off the chart. How are we going to make these modifications to ensure that they're safe? So tools for effective communication with handoffs. So the transfer of information during transitions of care. A big handoff would be when that patient comes in on the gurney from another hospital. We need to make sure we have all the data from their previous stay, even though Ray and myself have already vetted them coming in, or one of our designees a little bit down the road, right? That they meet all the criteria to even come to this facility. Okay. It shows here the purpose is to enhance information exchange at critical times and maintains continuity of care despite changing caregivers or residents. So, I mean, that definition right there is top notch. It's exactly what we're looking for. It shows here an example would be a shift report, a resident transfer, or a physician transferring responsibility. We have one physician here, which is Dr. Alexander Chan. We have not a downtime practice, but in the event that Dr. Chan is not here, we have a redundancy where we would use one of his nurse practitioners. So there's always physician coverage. Okay, let's talk about call out. The definition of call out is used to communicate critical or emergent information. Purpose is to inform all team members simultaneously during emergent situations. Let's get an example of what we would do during a code. So we have the leader. What is the airway status? The nurse would say the airway's clear. Leader, breath sounds decreased on the left. Blood pressure is 95/65. Just to make sure that we really get this out there is We are a BLS facility only. BLS. So if a patient codes in a code blue type situation, we are going to follow our BLS protocol, which we have a video dedicated going over the crash cart and how to utilize the AED that we have on site. But no, if a patient goes pulseless and they are not a DNR, DNI, we are going to call lights and sirens. We're going to call 911 and make sure that the ambulance gets here so that they can transfer to the patient to the appropriate level of care. I know many of you will have experience in placing advanced airways, myself included, but we need to know the scope of the care that we're providing here. So we do BLS, and honestly, when an AMBU bag is performed properly, we don't need to have an artificial airway until we take over their breathing when they're placed on a ventilator. We will not be doing that here in this facility. We will manage patients who have an artificial airway already and will be on a ventilator that's established, but we will not be initiating that practice here. It's just outside of our scope. Tools for effective communication. Check back. So it's the process to ensure information conveyed is understood as intended. We call this a three-step process. The sender initiates the message, the receiver accepts the message and provides feedback, and the sender double checks to ensure the message was received as intended. So we see here an example: apply 2 liters of oxygen via nasal cannula, nurse assisted. 2 liters oxygen via nasal cannula connected. That's what it should say. And the nurse says, yes, that's correct. What's the purpose of all this, of the 2-challenge rule? It empowers all staff members to stop the line if they sense or discover an essential safety breach. This can apply here in the cliff, guys, but one of the areas that you would see this most used is in like an ACLS code type setting when you're calling out the meds that you're pushing, in this high intensity environment. And it's also when an initial assertion is ignored, it is your responsibility to assertively voice concern at least 2 times to ensure it has been heard. The team member challenged must acknowledge. If the outcome is still unacceptable, take a stronger course of action, notify your supervisor. Okay. So that's more along the lines of what we're going to be doing here. Obviously, we're not going to administer if the patient needs a single liter and you're recognizing that their oxygen saturation is 99, there's nothing that's presenting to them, and the nurse says 15 liters, you can request clarification. Did you mean 15 liters? I just want to confirm before I put the patient on that, because the nasal cannula that you requested can only support up to 5 liters. Strategy to improve communication with residents and families. So why is it important? What are recommended methods of effective communication? What are challenges to effective communication? What are adverse events? And our response during an adverse event. Let's talk about with residents and family members. It's important for us to share this with them because it improves clinical outcomes. It enhances perception of quality. It improves resident safety, increases resident and family members' satisfaction, and improves adherence to care plans. It's important for us to notify the family if something's going wrong, okay? Because that open channel, that open line of communication brings trust. And that's very important when someone has their loved one here and we're trying to establish trust with them, right? How would you feel at the end of the day? How would you feel if your family member was here? What would your expectation be for a loved one? Maybe not a family member you really don't like, but someone that you really do like. So effective communication, continuing on, use the language the resident and families can understand. Okay. So we do have translation services here. I know that's not what this is saying, but just so you're aware, we utilize a platform, and it's posted at the nurse's station on how to activate it and how to use it. But remember, you may have a patient that has hearing loss, or they have dementia and could have an issue with family members who are just not here, and that they don't visit very often. We got to make sure we find a way to communicate with them so that it works with them. And we also are using jargon that is clear to their capabilities. Okay. And that's one of those ones that's here. We've already talked about that. We want to make sure that our information is complete, clear, and brief. Information is given timely. Sometimes we need to allow extra time. Many nursing residents have conditions which require longer information and processing time. We talked about that, right? Maybe there's some learning impairments. We need to check to make sure the information is being communicated, that information being communicated is understood. Your blood pressure is 60 over 20. We need to give you some fluids. Well, why do I need fluids? Okay, well, your heart is not able to pump the volume of blood it needs to with such a low pressure to your vital organs. So your brain needs more volume, something along those lines. Okay, listen carefully to the residents' responses and directly respond to the questions and concerns. Give residents an opportunity to ask questions and express themselves. Maintain a positive attitude, include a pleasant tone of voice and facial expression. Visual aids may be required as a method of communication. So challenges to effective communication, we've talked about these. So let's talk about communication with an adverse event. So an adverse event is an injury to a resident caused by a medical intervention rather than by the underlying disease or condition of the resident. One example I could give you about causing harm to a patient that's more benefit than it is a negative would be to draw labs. Hey, we have to hurt the patient in the form of inserting a needle to draw out blood to get information. Okay. What this is really talking about is something deeper. Okay. So there was an accident in the facility that caused an arm breakage or something along those lines. And the problem is that it's very hard for staff to take ownership and communicate this with the resident and the family because nobody wants to call someone's mom, or let me rephrase that, nobody wants to call someone's son or daughter saying that their mom had a fall and broke their arm under our watch. Because we know the response that we're going to receive. And that response that we're going to receive is a very angry person on the other line. And they're going to want to know why, under our care and guidance and supervision, that this happened. And that's a tough pill to swallow sometimes, but we do need to take ownership if it's a failure that's on our part. And those types of failures will lead to process improvement. So that way it won't happen to anyone else. Some of the strategies that we'll employ is communicating with the resident families in a prompt and compassionate manner. And then obviously being honest is extremely important after an adverse event. So immediate and subsequent response to an adverse event. Obviously, if the patient falls, we're going to pick them up, provide care for the resident, maybe send them out for an x-ray. Subsequent response might be an investigation. It's part of our root cause analysis. Immediate response is to report the incident. Someone's going to notify myself. Someone's going to notify Raymond. And we are going to, in addition to the family being notified, we'll be there to communicate with them as well. We do need to tell them the who, what, where, when, and why, and provide an apology and remediation. Must document the event. And then this is where our QI program comes into place, right? System and process improvement, measurement, and evaluation. So follow all related facility policies, and that's where this is the follow-up. So whenever you have an action that requires a response, it then prompts a training so that we can ensure that it doesn't happen to the next family member. When we're communicating in an adverse event to the family, and we've already covered this, but it's important, we want to make sure we speak slowly and we use clear language. We give an advanced alert. I'm afraid I have some news to share with you. Be hyper diligent about this particular slide, okay? Because that may be one of those things where it's like someone's bracing that their family member has died. So choose your words wisely there. Give the news in a few brief sentences, quietly wait for the reaction, and watch and listen for response signals. Obviously, you can't do that over the phone, but you can do it in person. Let's go over our key concepts. Effective communication involves sending, verifying, and validating techniques. Using tools can improve communication and teamwork with staff, residents, and family members. Effective communication decreases medical errors, improves outcomes, and improves satisfaction for staff, residents, and family members. Improved communication contributes to resident safety. Now, again, I've told you guys before, we are not regulated by Medicare, but it says CMS states that they did not propose to require a specific amount of time, specific communications, or specific training mechanisms to meet requirements of this F tag. It says training topics should reflect the needs of the resident population, needs for the staff. These should correspond with the facility assessment. Okay, so just so you guys are aware, we don't follow the Medicare guidelines because they're not required of us. However, there's a lot of things that we see that they've done that are just best practice. And so on that note, that's it for residents' rights and the facility responsibilities. I look forward to our next video, which is requirements of a compliance and ethic program. So I'm going to pull that up now.